Hi guys, Kane Harrison here. Welcome to PAI Medical, WeGrowHair.com Medical Minute. We're delighted to be joined by Michael Ramsey, who's Clinic Director at PAI Medical, WeGrowHair.com. Today we're going to talk about multi-unit hair grafting. Welcome, Michael.
Thank you.
Mate, walk us through multi-unit hair grafting.
So multi-unit hair grafting is a mouthful, right?
It is.
It's one of the two hair transplant options that we offer patients. It's a process that we trademarked and developed a number of years ago. And we did it for this reason. A lot of patients that were actually having transplant surgeries were complaining about the end result being a little bit too thin. They liked the naturalness, but they wanted a little bit more fullness. So we looked at different ways to help accommodate that. So keeping your naturalness, but also adding some volume. So we studied the scalp in depth and learned that the scalp has these little bundles called follicular unit bundles,
Right.
where you'll have 2 or 3 hairs that grow pretty close together. But there's something called multi-unit bundles where you'll have 2 or 3 hairs that grow close together, but then you'll have maybe another 2 hair grouping right next to that with a little bit of separation, a little bit of skin in between the two. And those natural bundles grow on the scalp, and that's what they do is provide density and volume. So in the past, what we would do is we would take those 2 bundles, if you will, and separate them and then put them somewhere else on the scalp. And we found by doing that, you got a very thin natural result, but again, it was thin. So we decided to start taking those bundles and keeping them in that natural sort of family, because it's sort of a family of hairs, and using those where it's appropriate, which is typically they're found behind the hairline. So if we were to look at your hair, you have a beautiful head of hair, by the way.
Well, thank you, sir.
And if we scoped your hair, we would see along the frontal hairline that typically you'll have a single hair growing from a single hole. But as we move back a few millimeters, we'll start to see 2 or 3 hairs growing from a single hole. We move back an inch or 2, and we'll find these groups that grow very, very close together. Again, the follicular unit bundles or follicular unit groups that will grow close to another follicular unit group, and that's what gives you density there.
Right.
So for the new way we do transplants, we incorporate, with multi-unit grafting that is, we incorporate these bundles to give more fullness and more volume. And that's what a lot of patients are looking for, more fullness and volume. And one of the benefits is we can move more hair in a single transplant, so the patient needs fewer transplant surgeries. So if you need 7,000 hairs, let's just say, to fill in a certain area, and we're not using multi-unit grafting, it's going to be hard to reach that goal.
Right.
So we can just give more density, more hair. It's a better value for patients. So it's not for everyone, but for a lot of patients, that's what they come to us for that.
Yeah. And just so the people at home know, this isn't the robotic procedure.
This is not the robotic procedure. This is more of a traditional type procedure where the robot's not involved. The reason we don't use the robot for multi-unit grafting is it's not capable of that yet.
Right.
You know, at some point in the future, it probably will be.
Sure.
But at this point, it's not able to do that. So for patients that are looking for a little bit more volume, a little bit more density in a single procedure, multi-unit grafting sometimes fits their needs better than, say, the robot.
And there might be some people wondering about scarring.
Yes.
That lineal scar that we've known from the 80s.
Yes, good point. So what we do today is it's called you hear the strip method, and it has a sort of a negative connotation. And it should, because 15 years ago, what would happen with a strip procedure is the surgeon would take out a strip of skin from the back of the head, which was about an inch in width. So it's fairly wide, right? So when the surgeon pulled the skin back together, it was under tension, so it would sometimes pull away and pull apart and create a linear scar that was noticeable if you had short hair. Today we use something called the thin strip method or the micro strip method. It's only the width of a popsicle stick, or about the width of a popsicle stick, so it's about 1 centimeter. Most Americans don't know what a centimeter is, but you do. But think of a popsicle stick roughly. So now, when we do the traditional option, if we're doing multi-unit grafting, for example, we will incorporate that technology where we'll take a very narrow strip from the back of the head, pull the skin that short distance back together, because again, it's not very wide. There's less tension, so there's less likelihood of the area sort of pulling apart and creating this wider linear scar. So generally what you'll see is a very fine, faint line back there. Now, it does eliminate the patient from shaving their head in the future.
Sure.
So if you shave your head with a razor blade, that little line is going to be visible. But the reality is we have a line back there anyway. So if I shaved my head, or let's say you did, and we looked at the back of your head, you've got a crease back there anyway. So we try to fall in that crease. It is a surgical remnant, so it doesn't look as natural as the crease. So if you do choose to shave your head, after that type of surgery, that line's visible. Now you can wear your hair short, not super short, because that little line can peek through the hair.
Right.
So that's one of the things with multi-unit grafting that's important to keep in mind.
Well, plenty of information. Of course, if you guys want more information about multi-unit grafting, jump online and check out wegrowhair.com. Michael, thanks so much for all this information. Of course, Michael and his team are fantastic. And as I said, if you want some more information, wegrowhair.com. But this has been a medical minute for PAI Medical, wegrowhair.com. And we look forward to seeing you next time.